Health Education Lecture Series. All the listeners of Health Education Lecture Series, I'm your host, Gurdeep Singh Sandhu, homeopathic consultant. My phone number is 408-687-1899. I'm here to deliver a next lecture of Health Education Lecture Series, but today's lecture will be in Angrezi because already sections of the abdomen are being discussed in Punjabi and Hindi. So I'm discussing it in the English media that this abdomen, I have already described about the abdomen that these are the boundaries. The upper boundary is made up of diaphragm, which separates the chest and the abdomen. That's a membrane type of, you can say, the division. And it has many openings inside it so that the blood vessels from upward and other many contents from upward goes downward and from downwards to go upwards. In this way, for their transmission or the traveling, there are some openings in this upper roof of the abdomen, you can say. And the floor of the abdomen is made up by the pelvic brim. And on one side there is a inguinal and ligament, and this is not divisible outwardly. Outwardly, there is only abdominal muscles, which you can see in the whole abdomen. And that whole abdomen has two parts. One is the pelvic area, the other one is the abdomen proper. And those are only covered by the membranes of the abdomen. And I have described those. The membranes of the abdomen are, first of all, the oblique membranes, oblique fibers from which goes from right side to left side. And from oblique, there are two types. There are two routes, you can say. One is external, one is internal. And after that, they are covered by the transverse abdominis muscle fibers. And after that, all these three type of muscles are binded by the rectus abdominis sheath, which comes from under the ribs and goes up to the inguinal ligament. So this is what the abdomen was made up of, but internally it is divided into two parts by the omentum, peritoneum, sorry, peritoneum. The one is the greater sac of peritoneum, the other one is the lesser sac of peritoneum. The lesser sac of the peritoneum covers the organs which are inside the pelvic area, which are covered by the bony structure, hip bone as well. And the other areas is all other organs in the abdomen are covered by the greater sac of peritoneum. So in this way, this abdomen internally is divided into two portions. And we were describing about the proper abdomen other than the pelvic area. That this abdomen was divided into 9 different parts for the easy description of the organs underneath. What are the organs inside the abdomen, where they are situated in the abdomens, and where there is a you can say the transmission of those organs for their functionings. So that has we are discussing now at that chapter, and we have discussed it in the other languages, but I will discuss today in English. And first of all, we draw two lines. Those are known as mid-clavicular lines. And everybody knows about, because I have already described in my previous lectures that there are two clavicle bones. Clavicle bones in front, it is united with this manubrium sterni, the upper portion of the sternum, or you can say the cap of the sternum, and which has three gaps. One unites with the shaft of the sternum, the other two on the sides are united with the clavicle bones, and the clavicle bones goes above the shoulder joints to bind the shoulders, and it takes part in that one. So those clavicle bones and I'm saying the anatomy basically. Whatever I'm saying means the anatomy is saying that two mid clavicular lines are drawn from that very point downward up to the inguinal ligament, up to the inguinal ligament. And when you draw two lines, automatically this abdomen is divided into three portions. One on its right side from the right transverse plane, sorry, not transverse, longitudinal plane. This is known as the longitudinal planes. This longitudinal planes of right side, there is a one portion of the abdomen that's the right side, and there is a one middle in between the two lines, longitudinal lines, mid-clavicular lines. That is the middle area, middle portion of the abdomen. And the third one on the left side is from the left of the left mid-clavicular line. So in this way, abdomen is easily divided into three portions. And now we have to draw two more lines. The upper one line we will draw from the subclavicular lines. From the costal, subcostal lines. Costa means ribs. So subcostal line, which is just at the level where our ribs are finished and the abdominal portion is started. Abdominal portion is started and ribs are finished over there. And if we draw that line at that level, you will see some portion of the abdomen remains upward, because from the front, if you see, the ribs are divided into a gap. Ribs goes right side on the flanks, and left side ribs goes left side on the flanks, and there is a gap. Means the abdominal portion still lies at that area. And the second thing is, underneath the ribs, there are some abdominal organs. Just like on right side there is a liver, on left side there is a spleen, and also a part of the liver as well. So it means, just I want to convey you that even this area on right side and left side is covered by the ribs, but still it's abdominal area. And that diaphragm goes in between that one to separate the chest area and the abdominal areas. So in this way, when we take the lower bottom line of the ribs, subcostal line. So subcostal line has three upper portion now. When we draw the subcostal line, and already the abdomen was divided into three portions, then all the three are divided upward into three portions. In this way, right portion is known as right hypochondric region, the middle portion is known as epigastric regions, and the third portion is known as splenic area or left hypochondric regions. Why? I can explain you here that the right side, hypo means underneath, chondria means ribs. Under the ribs, there is area which belongs to the abdomen, and that area, that is why it is known as right hypochondriac area, right side abdominal area, which is under the ribs but the portion of the abdomen. And right hypochondriac area and the middle area between the two mid clavicular lines, that is known as epigastric. So this right hypochondriac area is also known as hepatic area. Hepatic means liver, right hepatic area. And there are some other contents. I will let you know that how many contents are there other than the liver. But when we are going from right to the left side, the middle area is known as epigastric area. That epi means above, gastric means stomach. Underneath is a stomach. From that area where our ribs are divided in front and there is a gap, that area is known as epigastric area, means underneath that is a deep in the stomach. And that stomach has other contents as well, not only the stomach. So I will describe these two, but just I want to name it about all these portions of the abdomen. We have divided it, and then other area on the left side, we name it splenic area or left hypochondric area. Splenic area or left hypochondric area. Splenic lies under the ribs as well, just like the right side liver is lying under the ribs. The same way, the spleen is lying under the ribs on left side. And there are some other contents, but I will let you know about the contents. What are the contents in this side? First of all, I'm just recognizing the name of the areas. So when we draw, first First of all, we draw mid-clavicular lines. Two lines which are going from upward to downward. And now we have drawn one line from the the hypochondric lines. That line is dividing the abdomen into upper three portions. And those upper three portions we have named as right hypochondric area, that from the subcostal lines, sorry. And right hypochondric area, and middle is known as epigastric area, and the third one on the left side is known as splenic area. After that, we draw another line that is known as transtubercle plane. This is also a plane, subcostal plane. Sub means underneath, costal means ribs, plane means line. The same way, we draw another line that is known as transtubercle plane, just in the lower side of the abdomen, where you put your belt in, and the highest point of our hip bone, that is known as iliac crest. And on that iliac crest, there is a projection, there is some projected portion of the bone that is known as tubercle. And that tubercle is used for binding the ligaments, tightening the ligaments with that one to bind the pelvic rim with that one. So from that tubercle right side to the left side, if we draw one plane, one line, it divides the abdomen again into three upper portions and three lower portions. And because after this transtubercle plane, abdomen is still there, pelvic area is still there, because outward there is a total known as abdomen, but internally it is divisible, it is divided. So from outwardly, when we draw a line transtubercle plane, this abdomen is divided into again upper portion and lower portion. The upper portion has also the three divisions, the middle portion has also three divisions, the same way. So the middle area, now come to the middle area. So middle area on the right side, just under the liver area or the hypochondric area, which we termed as the area is known as right renal area. Right renal area. Renal means kidney. It belongs to the kidney. Okay. Right renal area. The main important organ inside in this area is the kidney. There are many more other organs. I will describe you what are the other organs. But the important organ is the renal area, the kidney. And then when we travel from this right side of the kidney area to the left side, and we cross that upper line, which is coming from the mid-clavicular line, that area is known as in between the two lines, which are coming from upward to downward. In between that area, that is known as the umbilical area. That umbilical area has also its different contents, and we will let you know about that one, that this is the umbilical area. And after that, there is the left side, the left kidney. because kidneys are two in number, one on right side of the abdomen and the back side, and one on left side of the abdomen. So in this way, the second line, second row, you can say, the first row, again I will repeat, the first row under the ribs was the right hypochondric region, epigastric region, and the splenic area, left hypochondric regions. And the lower portion, I am saying that it is right renal area. At the middle, I'm saying it is umbilical area. And the left side, I'm saying it is left renal area. So all these names, just like splenic area, the spleen is there, but still there are other organs. The same way, when I say the renal area, means the most important organ in this region is the kidney. But there are still organs. I will let you know what are the organs, because we have go to the diagnosis that if a person says, I'm having a pain abdomen, and then this simple language, this simple thing, when a patient says, it's a big examination for a doctor to diagnose, to understand what actually he has. The problem inside the abdomen, where it is. So that depends upon that one, and then that will further indicate that what type of treatments we need to do. So in this way, the major important organs I'm denoting here by the name of the areas. So right renal area, then going right renal area to the left side is the umbilical area. From umbilical area to going left side is the left renal area. So underneath that area downward goes up to the transtubercle plane at the highest level of the pelvic bone, you can say the ilium bone. So in this way, the underneath that portion is also divided into three portions. And in those three portions, there are still right inguinal area, right middle hypogastric area, and left inguinal area. So these are the three lower portions of the abdomen, though they are coming into the pelvic area. Though they are coming into the pelvic area, but they are part of the abdomen, but has been divided internally in a proper abdomen and in a pelvic areas, and they are divided by the peritoneal cavities, peritoneal coverings. The large peritoneal coverings and smaller peritoneal coverings, they are given broad name, broad ligament. The lesser sac, the greater sac of peritoneum covering the all abdominal organs. Above that, pelvic area. So this is what we have divided the abdomen into 9 different parts. And now let us come one by one. For the easy references, I can say that the right hypochondric region is known as the number one. The right and the epigastric region is known as the number two, and the third one is the splenic. Right left hypochondric area or the splenic area is number three. In this way, the right underneath that, the right renal area is a number four, and the umbilical area is a number five, and the left renal area is a number six. And underneath, again, there is a cecal inguinal area that is known as number seventh, and in between that in between the mid clavicular lines which are going downward, in between these two lines, there is a hypogastric area. Gastric means stomach again. And stomach sometimes, because it's a J type, the position of the stomach is J type. If you are standing and you have food inside that one, it may sometimes extend underneath the umbilical cord. So that is why this area is known as a hypogastric area. Hypo means niche, underneath, and gastric means stomach, and area means area. So hypogastric area is just under the umbilical area, and it is in the pelvic area. So we can name the right-sided area as the seventh, hypogastric area as eighth, and the left renal area as a number nine. So it's easy understanding that you can understand that there are nine different portions of the abdomen and they are having their different contents, but some of the contents are common in some of the areas because it depends upon the length of the organs, and in that way, just like the liver, right hypochondric area has the largest portion of the liver, but the liver is extended from right side, right hypochondric area, to the epigastric area, as well as some portion of that one goes to the left side of a splenic area under the spleen as well. So this is the liver, because the liver is a long side, long portion of that one. The right side is covering the most part. You can say the head part, most part, largest part of the liver is inside the right hypochondriac area, and lesser than that is in the epigastric area, and less than that, just like a tail, it has on the left side or the splenic areas. Now, let's come to the contents. Contents in number one, that is right hypochondriac area. The contents are the first one that already you know, that is a liver. And underneath the liver, there is another organ that is known as gallbladder. So, gallbladder is attached under the dome of the liver, and the function of this organ is it's just like a bag, empty bag, and continuously bile is liberated from the liver 24 hour continuously, and when we are taking food, this bile directly goes to the intestines to take its part in the digestion. I will let you know about that one. But when we are not eating, but we are eating 2 or 3 times in a 24 hours, which means bile is continuously being poured from the liver, generated from the liver, and that bile is stored into the gallbladder, so that whenever it is required to be used, it is used from this residual portion or this surplus portions. And that gallbladder is also lying in the right hypochondriac region. Underneath that one, there are there is large intestine, because large intestine is coming from downward to upward from the right inguinal area, right, that's known as cecal valve. Cecal valve is a position on right side where you put the belt over, where the small intestine is attaching with the large intestine. And also there are contents. I will let you know what are the contents, but let's go to the first portion at this time. So large intestine from that very area goes upward up to the level of the bottom of the liver, and then this large intestine takes a turn towards the left side. When it takes a turn towards the left side, there is a flexor turn that is known as hepatic flexor. Hepatic means liver. A turn near the liver is known as hepatic flexor. So at the hepatic flexor, which is also in the right hypochondriac area, which is also in the first number one area, and from here, some portion of the ascending, means when it's going upward, ascending large intestines, and that turn point, plus when the large intestine goes from here to the left side, some portion of the transverse colon. So ascending colon, portion of the ascending colon, for hepatic flexor, and some portion of the transverse colon. When the large intestine goes from here to left side, that's also a transverse colon. Some portion of it remains inside the right hypochondriac region up to the level of right mid-clavicular line. And in this way, this portion has these main important contents: liver, gallbladder, portion of the large intestines. And then going left side in the epigastric area, the epigastric area is in between two subclavicular lines which are going from upward to downward. In between these two lines, the area just at the top of the abdomen is known as epigastric area. And that epigastric area has inside, first of all, you see this large intestine is going from right side to left side. One. Second, the portion of the liver is still there in the epigastric area, but it's a type of slope, not big, larger portion, but becoming slope towards the left side. And large intestine and liver we counted, and underneath that there is a stomach. There is a stomach. That's why its main organ is the stomach. Other organs, just like the liver, just like the large intestines, they are passing by. It's not their position, but they are passing by. So these are the passing by organs, but the main organ which lies inside this area is known as the stomach. And then in this area, because the first portion of the small intestine lies underneath the stomach, and that has a portion known as ampulla of Vater. And that ampulla of Vater is a junction of pancreatic duct and the bile duct. Bile duct is coming from the liver and also from the gallbladder as well, and united to the intestine, small intestine, the first portion of the intestines after the stomach, and pour their solutions into that. Pancreas pours insulin in that one, and the bile duct pours the bile into it. They are taking part in the digestion of our food. I will describe later with the what type of the functions and all that one. So, but I'm just talking about the contents, that these are the contents in this area. So, main importantly, passing by is the liver, passing by is the large intestines, and the main content is a stomach. Main content is the first portion of the small intestine, that is known as the duodenum, and also a portion that is known as ampulla of Vater, where duct of the pancreas and duct, the bile duct, is also joining here. So these are also lying in this epigastric area. This is the important thing that we must note, that these are the main important thing. If anything happens in this area, the sugar metabolic rate may declines, may increase, whatever. And the same way the function of the bile is disturbed, and that also may cause jaundice type of things or many other things. I will describe later detail of these things. What happened if there is no bile? What happened if this bile is defective? What happens if the pancreas is damaged? And what happens if the insulin is not produced or is blocked somewhere? So all these things I will describe you later on, time to time. But now I'm just giving you the information what are the organs and what particular part of the abdomen. So we are passing through the epigastric area. Again, I'm repeating that there are passing by liver, passing by transverse colon of the intestines, and stomach properly, and the first portion of the intestine, that's the duodenum in, and the pancreatic portion, and also the bile duct. So all these things are lying in this one. Let's come to the left area, left upper area, that is the third area. So that third area, as we named it as the splenic area or the left hypochondria, from the left side of the left mid-clavicular line. From the clavicular line downward till plane is going, and from that plane, left area, left inside the abdomen, that is known as splenic area. Because the main content in this area is the spleen, but all other organs are just like passing by, just like they are touching this area. So what is touching this area? The large intestine turns from here downward. So it means a portion of transverse colon and a flexor that is known as splenic flexor, a turn of the large intestine, and descending colon when the large intestine is going downward. So all these things are here in this splenic area, and upward there is a spleen. And also the tail of the pancreas is also covered in this area, because this pancreas is known as, it is just like fish: head, body, and tail. And head was attached to the duodenum, the first portion of the intestines under the stomach, and it was the middle. And then after that there was a tail. That tail goes up to the left hypochondriac region, that's the splenic area. So in this area, so we have calculated, we have named all the major important organs of the abdomen, which lies in the upper three quadrants, upper three portions. And second, we are going to the right renal area. So when we are talking about the right renal area, the main important, definitely there is a renal, but kidney is lying in the back side of the abdomen. In the back side, if we count it, it is at the level of lumbar area. And from front side, if we count it, though this area is named as by the name of kidney, that's the right renal area. But the first of all, if we separate the abdominal wall and we see here, one is the large intestine ascending colon. Ascending colon of the intestine is also passing from this area going upward. Third, there is appendix. There's a portion known as a cecal valve. Cecal valve is a junction of small intestines with the large intestines, and a portion of the intestine, you can say the small intestine, is also extended outward, that is known as appendix. A portion of small intestine extended outward is known as appendix. I think you might have heard about the appendix. Everybody knows about the appendix. It was a serious thing previously when it was not mainly recognized, but now we know whereabout of this organs and what its functions, and what it can cause, what are the problems. So all these things we know about that one. I will let you know about this one completely. But let us count the organs and which are lying in one particular regions of this one. So now I'm talking about that in this right renal area there is a cecal valve, there is a appendix, there is a large intestines, ascending colon, large intestines, ascending colon. And when I say cecal valve, means the portion where the small intestine joins with the large intestine on the right side here is there. Underneath that, underneath that is a kidney and right kidney. So right kidney is there in the right side of the renal area between the subcostal plane and the transtubercle plane on the right side. And and above the kidney there is a gland, a type of triangular type of gland that is known as adrenaline gland. adrenaline gland is a part of endocrine system of our body. And the endocrine gland, to understand easily, function of the endocrine gland is just like a matchbox. Suppose if in a kitchen you have all the things, flour, salt, vegetables, everything, and all the utensils you need to cook some food or vegetables, whatever, but you do not have the matchbox, do you not have? Then what you will do? Nothing. Everything will remain there. The same thing. The endocrine system inside the body is made up of different glands on various portions of the body, and these glands generate a type of secretions that is known as hormones, and those hormones are liberated from each gland differently, and they are put into this bloodstream. They produce, and the blood comes there to give the food and oxygen to that gland. And when that blood goes back in the venous circle, they send their content of a hormone what they have made into that blood. And when the blood circulates throughout the body, all the hormone of all the endocrine glands are circulating time to time in the venous blood. They are circulating in the venous blood to go to the heart, and then via that they are again put into the circle to reach to each and every cell of the body. And I told you the function of the endocrine gland is a matchbox to start fire for the cooking or anything. So these are adrenaline glands situated above each kidney. These are two glands and two kidneys, right side and left side. And the function I already told you about this one. And this function is carried out, and I will tell you this is a detail, big detail of adrenaline glands, because a major endocrine gland. In this way, these are the main contents in this area. And also there are blood vessels, main blood vessels, which are which are coming to supply the food and the oxygen to the kidneys and also to the adrenaline gland. And the same way they are taking the garbage of the adrenaline gland and also the of kidney garbage to put it into the stream. Plus there is a ureter which has separated the water content or the urea and the toxic substances from the kidney. Kidney has already separated it, and that goes by a different channel, different line, that is known as ureter. And all these things are in this area. I'm naming all these things because every organ or any of these organ, if has any problem here, then there will be a characteristic of its pain, characteristics of its problem, so that we can come to know that which particular organ is affected, whether it is a kidney, whether it's a renal vein, whether it's renal artery, whether it's a ureter. So all these things are lying in this area, and we can recognize from the characteristic of their pain. They have their characteristic, and I will let you know about that one. What are the characteristics that you can come to know that This pain is belonging to the blood vessels. This pain is belongs to the ureter. And all these things I will let you know. Come to the umbilical area, the middle area in between the two mid-clavicular lines, which are coming from upper side, from the mid-clavicle to downward, just passing through the abdomen, and middle area where there is umbilicus, and area between the transtubercular plane at the bottom and the subcostal line. Upper subcostal line, the area between that is known as umbilical area. And that umbilical area has main content of small intestine. Coils of small intestines are collected over there just like a snake surrounding. And in between the middle, there is a gap. In between middle of this coils of the small intestines, there is a gap. And that gap is just in the center from where main blood vessels from the heart, that's the aorta, are going downward to supply up to the feet. And that is known as descending abdominal aorta. So main thing, descending abdominal aorta lies in this way, and also the vena cava, which is bringing blood back from the foot to upward to the supply it back to the heart. That is known as vena cava. And the inferior vena cava, inferior means which is coming from downward. The inferior vena cava is also passing from that center close to the vertebral column inside of the anterior side of the vertebral column. These two main blood vessels are passing. And that is why sometimes people say Taran. That's a name which is mainly known by the villager peoples. The actually thing is that because in the umbilical area there is a gap inside, and underneath that, up to the, just like a well, up to the vertebral column there is a gap, and close to the vertebral column there is a blood vessels, and that blood vessels are pumping like heart, throwing out the blood. So in this way, their beating, palpation is also heard from this time, and also palpated at this time. So in the umbilical area, the palpation of that descending abdominal aorta is felt over, and if the coils of intestines are displaced because of some injury, because of some sudden jerk, because of some weakness of the intestines, and the intestines are not keeping their position alive, and they are shifted from place to the other place, then they covered the area of that center area. And automatically, when they will cover the central area, it will be difficult to hear, to palpate the palpitation in the descending abdominal aorta. And where it will be felt? Where there is a gap, from where the small intestines have changed. If the small intestines have changed from the right side to center, definitely we will see that palpation more on right of the umbilicus cord, or if it is from the left side, we will see that palpation more on the left side of the umbilical cord. because umbilical cord area is covered by the intestines, and from where that intestine has moves, that has a gap. That is why this palpation of the descending abdominal aorta is felt over there, and people says it is it's a turn, that turn has a move. Basically, the turn means the center. Turn is known as the center, and the same way umbilicus is a center. So in this way, basically, the herniation is known as displacement of the organ. So now this is the displacement of the intestines. The intestines are moving. Basically, the small intestine has moved from its position, and it has come in the center in the umbilical area, and the palpation of the descending abdominal aorta is not felt at that area where it should be. It is felt somewhere else where there is a gap, and we say that it is moved. This is an indication for us to understand from where the intestines have moved, so that properly, if we replace that one, then we should massage the abdomen in a proper direction. And if we do not know that one, in the illiterate peoples in the villages, they rub the abdomen from upward to downward, from downward to upward, from right to the left, from left to the right. They do not know the proper way, that from which side the intestine have moved, and we have to push it back to the same side. There's no way to massage the whole abdomen, though sometimes the pain is felt in the whole abdomen localized to the umbilical area, because there is a mesentery, there is a covering of small, tiny blood vessels type of things covered under the mesentery. Mesentery is a type of big tent, and which sucks the nutrient from the food which we have eaten. And from the intestines, the squeezed nutrients come into that. And sometimes some portion becomes heavy, and there is a displacement of this one. But ultimately, this mesentery is all over in the abdomen, so that the material should be squeezed, nutrient should be squeezed from all the intestinal area. And when there is a congestion at one portion, definitely the whole area, you will feel the pain, feel the heaviness. So that's why we should take care properly when dealing with the umbilical area, that the mesentery is there, and also the intestine from one position has changed its position, has come to the central area. If its palpation is felt on the right side, up. If the palpation is felt on the left side, up. Or both ways, right side, downside, left side, it indicates us that the coils of small intestines have moved from that particular area where now palpation is felt. They are moved into the center side, in the umbilical area. So, if we know that one, then definitely we will massage, we will push down according to that. Its course, whatever its course is, how it goes there, then it will be easy to replacement. And then it will be more easy. Now come to the left side of the renal area, and the same thing I would like to repeat you. And there is a descending colon of the intestines, and also there is a again adrenaline gland above the renals. Small intestines, coils of that one are also in this area, and the descending colon of the large intestine is there here, and there's the adrenaline gland above the kidney. All these things are in this area, and the blood vessels which are going into the kidney, which are coming out of the kidney, out from the kidney. So all they are also here in this left side area, just we describe in the right side. So in this way, we know the contents of the abdomen in six different areas. Now come to the other areas. The other area is right side area. That's this number seventh area, right inguinal area. Right inguinal. When we say inguinal, means there is a inguinal ligament, there is inguinal canal, and there is appendix as well. All these things are here in this area, and also in this area falls the ovary and also the fallopian tubes. After that, the middle area. That is, the middle area is known as hypogastric area, and that has hypo means under, gastric means stomach. Under the stomach area, sometimes the stomach is J type and extends underneath the umbilicus as well. So that under that area is the hypogastric area, and the uterus, the fallopian tubes, and the ovarian ligament, which is attached with the uterus, all those are in this area. And the mainly the broad ligament, the peritoneal covering, which covers all these female genital organs insides, they are there in the hypogastric areas. But remember, deep in this hypogastric area is a area of rectum, because the large intestine from the left side, when it goes downward and it reaches up to the level of iliac crest, the upper portion of our bone, it turns downward and backward. Downward is going already, and plus backward towards the anus. And the first portion, which is diversion of the large intestine, is known as sigmoid colon. That sigmoid colon is the continuation of the descending colon of large intestine. And that large intestine portion of this one portion of large intestine, yeah. So portion of large intestine is also coming downward, and when at the level of the highest level of the bone, it goes downward towards the anus, because our anus is in the backside. Towards the anus, it goes backward as well. And that is known as a sigmoid colon. And under the sigmoid colon, there is a rectum. Rectum and the anus both lies in the hypogastric area up to the vertebral column or the coccyx portion of the vertebral column, the tail of our backbone. Our backbone is the vertebral column. So it's coming downward, coming down, and you see it's a tail at the end. This vertebral column becomes thin like a tail. And that tail portion and organs above that one, just like I described, the anus, rectum, and this one, portion of the sigmoid colon is turning downward, are lying in the hypogastric area. Uterus, I already told you, and also the portion of vagina, female genital organs. In case of females, the vagina, and the urethra. All these portions are lying in this area that is known as hypogastric area. In male, there is a prostate. In male, in this hypogastric area, there is a prostate, and then go to the left side. Then go to the left side. That is the left inguinal area. That is the same thing. The inguinal canal is still there, and the junction of descending colon and the sigmoid colon is there. Sigmoid colon going backward is there. So these are the main contents of this area, left inguinal area, and also this is covering the main blood vessels which are going from upward to downward, from downward to upward to supply the blood, that is the aorta. And here its name as femoral artery because it is close to the femur bone. It's a femoral artery is also the junction of that femoral artery. You can the origin of the femoral artery, the start of the femoral artery is there. So this is what are the contents of our abdomen in the 9 sections. I will try to bring some picture to show you in the next program so that everybody can easily understand what I am saying. If you are making a picture in your mind, what I am saying, I think you can understand even without that sketch. But next time I will try to bring that picture here to show you that this is what I am talking about. These are the the mid clavicular lines. This is one clavicle line. This is the left side of the clavicle lines. These are the subcostal line. The other one is the transtubercle lines, by which we have divided the abdomen into 9 different portions. And then the organs inside that one we have described you, but I will try to explain it into the picture as well so that you can understand easily in my next program. And please remain be attached with these programs, and if ever you see something you are getting out of these programs which is knowledgeable and you need that knowledge and it's good for you for your health, then please tell this to other relatives, friends, so that they can join me at Facebook or at YouTube. There is my YouTube channel, Homeopathic Natural Medicines by Dr. Gurdeep Singh, and also the Sabarang radio station, sabarangstation.com. If you go to sabarangstation.com, you will find the Sabarang radio stations. And even if you have a tune in media, you can listen this radio all over the world wherever you are, whether you are traveling, whether you are sitting at home, or wherever you are. You can go to the tune in, and you are driving, enjoying, and all the it's not only the health program is there. This radio is running since 2012, and ultimately what we do here in the morning time, there is a Gurbani program and Japji Sahib programs, and on Saturday and Sunday there is a Sukhmani Sahib, and after that there is a Shabad Kirtan, then Bhajan Kirtan, then after that your Rangaranga programs starts, and after every program, just like Rangaranga program, Filmi Geet, and the local Loktara Geets, and all those things are given in sect by sect. And between all the programs, if we are giving filmy geese, after that there is a skit. If we are giving Punjabi filmy geese, after that there is a skit. In this way, in between every program, there is a skits for your entertainments. And those persons who are well-known entertainers in this field, they are joining us in this radio. And you can see the skits of there, so that you can change your mind, and there is the entertainment of that one. And ultimately these programs continued at the evening time from 5 to 6 p.m. in California Pacific Standard Time. I'm here for yours, in your society, and I'm giving you the information about the health, that how we can maintain our health. First of all, we should know about this body, where the organs are, what they do. When you know all these things, then ultimately you can know if any of the organ is defective, what signs it will give us outwardly, so that we can understand even before going to the doctors. We can understand and what's the problem and what organ has been affected, and what initially you can do that. So all these things, information I'm giving to you. I'm your host, Gurdeep Singh Sandhu. If ever you have any problem at any age and tired of any treatments, you want to get second opinion, or you want to take homeopathic scientific approach of treatments, you can call me 408 687 1899 anytime to discuss your case. Or if you want to take a second opinion, even then you can call me the same number, 408 687 1899. Rabrakha, God bless you all. We'll see you tomorrow, and that lecture will be in Hindi. Perhaps no Hindi is already described in Hindi, and I will try to bring the calendar if I can, so that you can understand what are the portions I have described and has been described in the anatomical books. So I will let you know about that. God bless you all. See you tomorrow.